saying 10,000 visits a year, 7 shares?
Yeah, more. I think we'll get to around 12,000 this year.
Is that right?
The community health centers are such vital pieces of the overall healthcare landscape in Massachusetts. They were invented here in Massachusetts in 1965. We have 49 of them across the Commonwealth, and right now community health centers are seeing nearly 1 in 8 of the patients in the Commonwealth. And over the last number of years, the Patrick administration has made a conscious effort to invest in those community health centers.
Learning how to properly breastfeed.
Oh,
so
she's adorable.
Yeah. So we usually go to the Southern JP Health Clinic, but they referred us over here. They said there was a
Look at that.
a lactation group here, so we came down here to see it.
This is really about health, you know, not only from a behavioral health perspective, a physical health, but what we've heard today is about fitness and about nutrition and about safe sleeping and about really the overall health of the community.
You know, I think that's what's so great about community health centers, that word community, it really feels like that. And especially with our OB department, we make sure that all of our patients feel that from the beginning. So,
in many of the communities that the community health centers sit, they are real economic engines of the respective communities that they have. Today we were fortunate to see Codman Health, who has opened up a school. So they are not only a part of health, but they're really a part of each of the communities and are really making a difference.
The Codman Square Health Center, situated here in Codman Square, can think about health outcomes that are specific to our individual community. For example, the doctors upstairs said, we want your help, students, in tackling this issue that's really germane to this community. We are noticing that there's an increase in STI outbreaks at these points of the year, right? And the kids looked at the data really quickly and said, oh, we know why that happens. That's right around school vacation week. You know, that's carnival time. The kids use that data. They went and did a project where they created a pamphlet all about chlamydia, which is also the #1 STI that's in this community, that was intended to go out to students. Right? And so that kind of thing can happen with our partnership, and it can also happen in a community health center in a way that I think is more unlikely at a hospital.
The governor's been on point about, you know, investing in resources that will ultimately make a difference for the long term. This is a long-term strategy, and it's how he's governed the entire time, and we're seeing it here in all of these community health centers.